Hi, Bill Chun here. Today, we're going to talk about narrowing the choices you have to find the right prenatal care provider. So if you saw the last video, we talked about how eliminate offices which do not accept Medicaid and try to find an office which does meet and greet. Today, I'm going to tell you questions to ask. I made an acronym of ICED. I-C-E-D. I stands for induction of labor, C stands for cesarean section, E for episiotomy, and D, this is the big one, depression, referring to postpartum depression, as well as depression during pregnancy. You should be asking these questions. Doc, Chun, what is your induction rate? Because you heard of induction, right? Meaning before one goes into labor, talking about putting you into labor with artificial methods. And I would say, hey, guess what? My induction rate is one of the lowest in the hospital that I work out of currently. Or if I say, I don't know, then I'm telling you a lie, because we all know the rate. What about cesarean section? Currently, 1 out of 3 babies in this country born by cesarean section. Chun, what's your C-section rate? 1 out of 6. Okay, if I say I don't know, again, it's a lie. Episiotomy. Episiotomy is a procedure where usually with a scissor, we cut that area, bottom of the vagina, towards the anus, try to deliver the baby. And if I'm asked, how often do I do it? I'd say, you know what? In 30 years, I can't remember the last time I did one. I know how to do it in case of emergency, but I can't remember. It's rarely done in my practice. If the answer is, I don't know, another lie, because you know what? Every episiotomy case gets reviewed in a typical OBGYN department meeting. Let's talk about postpartum depression. I want to tell you something. The way we are paid by insurance companies is that whether I see you 15 or 20 times while you're pregnant, plus delivery, plus postpartum care, we get paid one global sum. Now, you ask a potential doctor, Doc, if I had a C-section, when will you see me? You know what most doctors are going to say? 6 weeks. That's right. C-section or not, vaginal delivery, they don't care. They won't see you for 6 weeks. Can you imagine? I can't imagine. Usually in my practice, the six-week visit is usually the 3rd. Now, why do I do that? Because you need it. Why don't other doctors do it? Guess what? They don't get paid. Remember, money controls and directs healthcare. So these doctors have made a business decision. That's right, business decision. Why should they spend time with you, especially in postpartum period? You had a rough labor and delivery, you had a C-section, and you are traumatized, and you need to speak with your provider. Oh, I'm sorry, I'm going to wait 6 weeks? No. You have to be seen. So if an office says, nope, 6 weeks, that's our routine, you should eliminate that office. ICED, remember that. Induction rate, cesarean section rate, episiotomy rate, and depression, talking about postpartum depression. Use this as a guideline to figure out, do you want to go see Dr. Jones or Dr. Brown? Maybe neither. Remember, I'm on your side. If you found today's video helpful, click here to subscribe, and you can click here to watch more videos. Until next time.